So, good morning, everyone. Well, basically what the WHO says, and we all agree to it, is, clean air is very, very essential for the, health and the well-being of the human being. However, the pollution is continuing challenge, both globally, regionally, as well as, in this country as well. We are familiar with this picture. Even in China, even while practicing the wushu, they seem to be wearing the mask. In terms of the impact, about more than 3.5 million people are supposed to be dying from the air pollution. And it is increasing, both in our neighboring countries, China, as well as in India. So therefore, we, being squeezed in between these two giant countries, we are naturally unable to escape. And in terms of the economic cost, there is a huge economic cost that is caused by the air pollution. And according to the WHO, globally, there is a significant rise in terms of the diseases, what we call non-communicable, like diabetes, hypertension, heart disease, respiratory diseases, cancer, and so on and so forth. So each country, they have calculated and done the statistics, and every country's situation has been summarized in this publication. This is a freely downloadable document, so if you are interested, you could do it so. In terms of Nepal, this is what it is. The one on the blue side is the communicable, and the other side cardiovascular diseases, the cancer. In the gray area is the chronic respiratory diseases. So as you see, more and more, this used to be quite the reverse, maybe about 30 years ago. Mainly the infectious diseases used to take the toll for most of the population at large. Basically, as we all know, if we have to survive, we need to breathe air, right? And our body system is designed so that we could take the air from the atmosphere and utilize it for our bodily processes. And the air, as it turns out, it is freely available. We don't yet have to buy the air like we do in terms of the water in many places. So this is how our body is. Lung is here. This is how different part of the lung is, where the air is supposed to be passing through. And if you were to open it up, this is what will it look like. In between is the heart, the down below is the liver, and so on and so forth. The point that I would like to describe about is if we were to take a small piece of the lung and enlarge it, which I'm sure many of you in the audience are very familiar with, the point is our lung is basically a big collection of the balloons, small balloons. And it is in that balloon, when we take the breath, the air goes in, including the oxygen. And when it reaches in those balloons, the oxygen passes into the blood. And when it passes, these are the blood cells that is deprived of the oxygen. When the blood returns to the heart, that do not have the oxygen. And as oxygen gets into the blood, it becomes red, and then it brings to all the system and the cells and the tissues of our body. So why I'm telling this to you is, since this is the basic mechanism by which our body is built up, and oxygen, so essential for our life, is taken into our system, this is where the air pollution is supposed to be causing harm. If we were to look into the part of the lung, part of the tube that carries the air in and out of our body, if we were to look it under the microscope, this is what it will see. The upper part is kind of a cleaning mechanism, the brooms. Any particles, any stuff that gets into the lung is basically gets swept up. It is a one-way traffic. It would bring whatever material there is outside the body. Especially when we cough, that will also help to bring it up. But even if you do not cough, it will continuously sweep the stuff up in the upward direction, so that the lungs will remain clean, remain free of any noxious substances, free of any foreign particles. Okay? We know air contains a lot of stuff, mostly nitrogen, oxygen, and in a very, very small proportion, what we call carbon dioxide, the argon, and the water vapor. This is the normal composition of the air that we breathe in. We wish this was exactly what it was. Okay? But this air gets polluted by so many things. Unwanted and harmful substances. All right? So this could be because of the things that gets emitted in the atmosphere, what we call primary pollutants, or it could be secondary pollutants when these chemicals react in the atmosphere and form a new kind of a chemical, then we name them as these secondary pollutants. Again, very familiar scene. Some are produced in large amount, including our brick factory on the right lower side. And we also have a smaller scale sources of the pollution here. Mostly, when we talk about the indoor pollution, this is what you see in most of the rural areas. At least in Nepal, I do not know how much and to what extent the same practice is prevalent in many of your countries. But on top of that, we also have certain behaviors that leads to stuff that again ultimately is going to cause damage to our body system. While this is true that these are the immediate sources of the pollution, one thing that we should be reminded of is that why people end up doing what they do like this. Is it because they don't have knowledge? Or if someone has knowledge but do not have the resources, would they have chosen to cook their daily food in this kind of a situation? Okay, so what I'm trying to say is that we have to look beyond the causes beyond the causes. Okay? So the immediate causes is probably just the tip of the iceberg, and there are a lot of socio-economic and cultural factors that lead to the ultimate production of those pollutions. And what is important for us from the health standpoint is that the coarse particle, which is between 2.5 and 10, when it enters into our body, they get trapped in the upper part of the respiratory tract. So they do not necessarily goes all the way in and cause damage there. All those balloons that I showed you earlier. Okay? But it's mainly in the, at the surface level primarily. And the smaller the particles, its tendency to go deep down and cause the damage is much more. But if one were to stay inside the home, not go into the outside, but do engage in certain behaviors or certain environment inside the home, you also get different kind of pollutants. Particularly one is the tobacco smoke and some of the biological allergen, this depending upon what sort of hygienic level you have in your home and how much moisture or the cleanliness, you may have some other biological particles that again could cause damage or harm to our body system. So we do not get that much outside, but when it comes to the indoor pollution, these are also some of the stuff that we need to be aware about. So what happens is, all this gets into the lungs, even though the picture compares the lungs of those who smokes and do not smoke, but essentially this could be taken as an example, what happens to your lung, whether you are exposed to the pollution versus not exposed. Just to give you an example, if one were to cut down the piece of lung and look it under the microscope, this is what is called a very much a healthy picture of a good lung. But if a person gets continuously exposed to all kind of a pollution in a heavy dose, our lung becomes like this. All right? This is not imaginary picture. It is the real picture of the patient who have developed disease due to continuous exposure to significant degree of pollutants. The upper part shows the normal size of the airway tube through which the air passes in and comes out as we breathe. But on the lower side, as the same tube get exposed to a continuous, in a long-term manner with all kind of pollutants, there is a lot of structural changes in our tube and it becomes very, very narrow. And as you could imagine, for the air to go in and out from those narrowed lumen, narrowed tube, that causes a lot of changes in the way that your body functions. Okay? Body tries to understand that there is something is obstructing in your tube because it is swollen up because of the pollution, and then a lot of cough, shortness of breath, particularly when you try to walk or climb stairs or whatever it is. But then that would not go away because there is a lot of structural changes. It's a permanent changes may happen depending upon at what point in time we caught the process. And again, this is not a imaginary picture. If we were to cut a piece of lung, as we did earlier, on the left-hand side is what it should look like in a normal patient, normal person. But the same structure, if we were to cut it out and look under the microscope, compare the area through which the air is supposed to pass in and out. Okay? So what we are talking about is that there is a real harm, a real unwanted result from the continuous exposure to the different kind of pollutants. If we were to list some of the diseases that is caused by the exposure to pollutants, these should be some of the major diseases. We could have infection in the upper part of the respiratory tract or the lower part of the respiratory tract, chronic obstructive pulmonary disease, which is a chronic cough and the shortness of breath. One could have asthma, one could have cancer. People who have got exposure to the pollution are more susceptible to develop infection like TB. People or the mother who is exposed to the pollutants have got their babies of low birth weight. The cataracts is an eye problem. People also develop hypertension and the heart attack when they are continuously exposed to these substances. So if we could remember this picture, this will be a very useful thing. Having recognized some of the harmful effects of these different substances, WHO has developed a guideline as to how much it should be, what is the desirable level of the pollutants, and if we cross that limit, what sort of harmful effect one can have. But each nation also have developed their own national guideline. I am sure in the countries where you come from, you also would have the guideline. Here in Nepal, this is what we have. Particulate matters, what is the level that we are supposed to be allowable level of the concentration, carbon monoxide, carbon dioxide, etc. We do not have all the chemicals that is being listed here. Remember this PM10, 120 to 200 microgram per meter, cubic meter, whether depending on it's a 1 hour exposure versus the 24-hour exposure. If one were to burn the different types of biomass fuel, this is the amount of the PM10 that seem to come out. If we burn 1 kg of the wood, which in the current situation in Nepal, so what does this all mean at the end of the day? Number one, people who develop this disease suffer, all right, at the individual level, who gets repeated kind of a worsening at times depending upon their exposure to the different pollutants. There are a lot of what we call absenteeism. People could not go and do their job. In addition, because of the disease, one is required to take medicine, and which is not something that you take for week or month. It has to be a kind of a lifelong process, and that costs money. And sometimes, depending upon how severe the disease is, you also are required to take the oxygen because of the changes in the lungs. The oxygen that is available in the atmosphere that you and I are breathing at present could not go into the blood through those balloons that I showed you earlier, because all those balloons are destroyed. There's no way that they can pass through to the blood. And therefore, you need to give extra oxygen. And again, getting the extra oxygen, paying for it, becomes a significant challenge, especially if you do not have a good family support. It's a very heavy tank. At times, you get very worse, very serious, and you go to visit the doctor, and the doctor says, no, you have got a very serious situation here. You need to come and stay in the hospital. And this is not free, at least in the context of Nepal, where there's no health insurance, so people have to pay the money out of their pocket. And again, it increases the expenses on top of what the person was having to begin with. And ultimately, because of the disease, they end up dying prematurely. So this is what all means in terms of the ultimate impact of the air pollution in life, in the real life situation. There has been a study in the United States, and what it says is that depending upon the level of the fine particulate matter, if you could reduce it below the limit that has been specified, it has shown a significant increase in the life expectancy of the person. They have done a comparative studies. When the particulate matter was of certain level at a certain point in time, they control it, and then they measured it again after many years, and they showed a significant difference in the health outcome of the population. So what does this mean? How shall we go about it? As someone said, the description of the problem is not sufficient. Many people have described the world, what the world is like and all these things, but we also need to change it, right? So I will share my perspective on what we can do. Especially you guys are so important player in bringing the change in your and our respective societies. Number one is what we need to do is probably the public awareness. Many people do not know as of now many of the harmful effects of the air pollution and even the cigarette smoke. So that is where the media could be a crucial crusader, if you will. Awareness is fine, but what after the awareness? Well, at the individual level, we could do something. If you are a smoker, you could quit it. At least you do not smoke in-house. All right? So that you could protect your family. You could buy and wear masks to minimize the potential harmful effect of the various pollutants. But more important than is the civil protest. In order to get the attention and build the pressure from those who are responsible in managing this, that might be an effective way. And obviously policy advocacy and for the legislative measures. But then if you make the law but do not give a feasible option for those, for example, people are cooking with the firewood. If you say no firewood should be used to cook, and if you do not give the option how else could they cook it, then this is not going to work. So we have to have an alternative feasible option in place of that as well. So this is a picture from China. A mother and daughter saying and demonstrating to the public no to PM 2.5. You can also have the demonstration, civil demonstration, peaceful demonstration like this to raise the public awareness. These are the politicians of our top leaders of this nation. And everybody is, focusing their eyes to sit in that chair. That chair belongs to the Prime Minister. And they need public support. They need to win the majority in the election. So there is a potential opportunity for us, for the public, to pressurize them in building the right kind of legislative measures. And if we could do that and could build the right kind of legislative policies, that will have a significant impact in controlling the air pollution. We are said, the biologist, the scientist says that we, human beings, have evolved from apes, right? So if we are truly human beings, we should not behave like the ape does. No, I don't want to hear about the air pollution, or I don't want to see the air pollution, or I don't want to speak about the air pollution. That's not going to bring the change so much required in preventing ourselves, our families, our neighbors, our societies, our nation, and all those unfortunate victims of the air pollution. I think this is going to be my last slide. So thank you very much for your kind attention.